Good afternoon and welcome to the Senior Hour, which is sponsored by Comfort Keepers in-Home Care and Providence Holy Cross Medical Center. I'm Barbara Cochran with my co-host,
Kevin McDonald.
On your hometown station, 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our first guest this afternoon is Dr. Anirudh Rai, who is from Henry Mayo Hospital, and we're going to be talking about vaccines.
Absolutely, yeah. It's it's good to be back on board here, honestly. And vaccines is a very big topic, especially in the senior community. I know we've been talking about some of these cases. I know measles was in the news recently, and usually it is a kid-borne illness. Usually children get it for the most part. But when it comes to the senior community, I think vaccinations is a much more important topic to talk about, particularly in our senior community. And one of the big ones is definitely shingles. I don't know if you've had experience with shingles or had patients or relatives who had shingles before, but that is definitely a big topic.
I've never had shingles. I've had the
blessings.
shot. The shot.
That's pretty good. Usually with shingles, you definitely don't want to experience that. Usually it starts off with a rash, which is quite painful. It's nothing like you've ever experienced before. Thankfully, the shingles vaccine, the Shingrix, has been proven to be very effective. Typically, all insurance covers it. And to give you an idea of how shingles works, as you know, it's a virus that you've had as a kid, the chickenpox. It lays dormant in your spine, or particularly in the nerves. And then whenever your immune system is taking a break, or if you're really stressed, and as you get older, your immune system does get a little bit weaker, it does pop out. And typically the vaccine, we know, does improve recovery for that. They say that patients or anyone above the age of 50 has about a 1 in 3 chance of getting shingles going in the future. So it is a very important vaccine.
1 in 3?
1 in 3. So it is very important to get.
So who do I stay away from? Everyone?
That's a great question. We still want you to interact and talk to people, honestly. We really can't predict when it comes out or where it'll come out. But honestly, the best thing to do is just be cautious. Talk to your doctor, your primary care doctor. They could get you more in-depth analysis about, okay, this shot is for you. It is something that can be helpful. Or if there's more questions, I think it's good to get involved in that.
Should seniors have a card indicating that they have had the shingles shot?
Ideally, I don't think an identification like that is typically necessary. Usually the database in your primary care office, or even what they call the CARE, which is the California Immunization Registry, does have that information there. Ideally, having the vaccine in your system is the best thing to do to kind of protect yourself against shingles, because for the most part, you only want to see it once and not get it ever.
And Doctor, share with us a little bit. We had, I grew up with 6 brothers and sisters. We all got chickenpox at the same time as it ran through our household. So it's in our system, right? So God bless my mother for those days. And then fast forward to now, people in their 60s, and if we had chickenpox in the day, what does this vaccine do? Does it prevent it, or does it help if we get shingles?
That's a great
Talk about
question.
that a little bit.
That's a really good question. So I know back in the day they used to say that they had these sick parties, I guess. They kind of, that's what I heard people call them. They're like, they try to get kids to be in areas where people have the similar symptoms and try to get them essentially immune to it. In a sense, I guess theory, it's an okay idea because you want the exposure to it. But in looking in the future, as you're getting older, the way this virus works is essentially it's in your system and it kind of stays hidden in the nerves. In a sense, it's a pretty smart virus because it knows, in a certain extent, that your body needs the nerves. It's not going to get rid of the nerves. And the nerves, for the most part, are very important. So it kind of stays hidden there. And anytime your immune system takes a little break, and when I mean break means it gets weakened, and this could happen if you're really stressed, if you're worried about something, that could definitely decrease your immune system. And when that happens, the virus sees an opportunity and it starts causing the same sort of havoc. And essentially, it's much worse. When we were younger, yes, these kind of sick parties and getting these exposure to chickenpox, I would say in that science maybe would have been an okay idea just because your body would have to get the immune system updated. Mm-hmm. But ideally we're looking at it now saying, okay, we have to just prepare for what the future essentially consequences are, because the virus is going to be there. But the other issue is that this virus is pretty common. Everyone's going to get some exposure to it one way or another. And it's important to essentially be informed about it, talk to your doctor about it, and just be cautious about it, honestly. And less stress is always going to help. I don't know if that's going to be important this time, right. But stress plays a big role too.
And we have different stressors in different times in our lives.
Absolutely.
So it's getting, because I'm always asked, first question, Kevin, did you get your shingles shot yet? And is it preventing it, or is it just help if you get it, it's a less
Good
impact?
question. I did forget to answer that last time. So this vaccine essentially it lessens the chance of you having either an occurrence, meaning that you may not get it, but more often than not, I would say the greater benefit is it decreases your chance of having lasting effects. Typically with shingles, you could have the rash that comes, but what happens is when it heals, you could have this lasting pain that could pretty much be present for the rest of your life. So it is something that we want to prevent. The condition is called post-herpetic neuralgia, and there's different forms of it, and the idea is that the damage that the virus has caused in those nerves is essentially permanent. And it can be a pretty aching pain. It could be a throbbing pain. You could have no pain at all. And what this vaccine does is it gives your body a fighting chance to at least prevent that from occurring. So it gives your body a recovery chance, best way to describe it.
And my friends have just said it's painful. It's a painful symptoms.
It is. I mean, I've seen it once, and I definitely don't want to get it. I'll tell you right now. And the other issues is if it gets in your face or in the facial region, sometimes it can cause blindness, and it can cause a lot of harm, honestly. But bottom line is this vaccine is safe. It's been effective. It's been tested thoroughly. I've seen the data too. And this is the newer vaccine. Before, I think it was a little bit over 5 or 10 years ago, they had the Rotavax, which we found out wasn't as effective. But this newer vaccine, the Shingrix, it tends to be much more protective. All insurance covers it. They looked at the data, and your doctor should have more information if it's right for you or not.
And what's it called again?
The Shingrix.
Shingrix. And,
Yeah.
and it's been out
Shingrix.
5 years?
It's been out for
Okay.
quite a while actually, and it was the newer one out when they replaced the previous one.
Okay. Wow. It's a lot of information.
Absolutely. But the good news about this vaccine is it's not one you have to take yearly. It's something that you take essentially 2 shots of, and you're good for the rest of your life.
2 shots, you're done for life?
For life.
2 shots.
2 shots. Not gonna lie though, I have some cases where patients were kind of knocked out the next day, so it is something you will feel. But ideally, you'd rather have that rather than the actual shingles. I'll tell you.
It's interesting because my daughter asked me if I had any effects. I said, no, nothing bothered me. I felt
impressive.
normal, you know.
That's pretty good, actually. You have a good immune system then.
So, well, I supposedly don't. I haven't what is it? Some kind of immune system. I forget the word.
Some sort of deficiency or some, I guess, suppression. It looks like of some sort.
Well, I'm anemic.
Well, that's a little bit different. Usually that's a different category in general. Anemia just means you lack either what they usually refer to as red blood cells. But you're right. There are some theories I've read about that can decrease your immune response. But thankfully, the vaccine, particularly the Shingrix, does kind of help give your immune system more of a fighting chance.
So if I've had one shot, do I need to get another one then?
If it's particularly the Shingrix, yes. Typically, they space it within 1 or 2 months apart, and we want that. The reason for that is they say, at least in the studies, the first shot gives you about a 90% coverage of shingles, but the second shot bumps it up to 99. So it's that extra 9%.
I don't remember whether I got a second shot.
We'll have to check you out, Barbara.
That's what happens as you get older.
Oh,
Not old, just older.
we
Good
have our
heavens.
memory things. That's all right.
Yeah, that's what happens. The memory. It says bye-bye. See you later.
So, Dr. B, in Senior Hour, what are your other concerns for seniors if you're worried about your loved ones?
Absolutely. So vaccines is one we touched on, and to kind of stay on that topic, the flu shot. Definitely taking that yearly is very effective. I've seen the flu knock out people like mad. Even now I'm seeing the flu come up. So whenever the year comes out, definitely take your flu shot. The other shots we recommend are the pneumonia shot. So the strep is the bacteria that's the cause of it, and typically we want our senior population to be basically immune to it because it can cause pneumonia, which essentially it's not a good thing, just to the bottom line. And talk to your doctor about it. It is also an important vaccine to talk about.
Now, and talk about the flu shot. Now we're in March. Still relevant, or is it the end of that season?
Well, ideally, I would say you can take it if you need to, but right now I would say it is a bit outdated because they're working on the next flu shot, which is going to be at the end of the year. So I would say hold off if you can. If you need the flu shot, definitely it's safe to take, but a more updated one will come later in the year.
And let me ask you about next year, because I always get confused when they say there's 2 types of flu shots, one for seniors and one for other non-seniors. Can you just explain that? Because that always baffled us at the
Absolutely. So the only main difference there is actually the dosage or the concentration. So typically for a normal flu, they get, let's say just for radio's sake, you get like 0.5. For seniors, they would probably double dose to 1. So the reason for that is, again, the immune system. they noted that in studies that if our older population gets the flu shot at the reduced dose as the normal population, the immune system doesn't respond as much. So you won't have enough coverage. Typically, we want a robust response where your immune system recognizes it, tackles the organism quickly and effectively, and prevents the disease from progressing. So the higher dose just tends to be a bit more efficient for our older population. So that's just the main difference. It's the same shot, just a higher dosage.
Wow. Okay, that's like breaking news because we thought it was a whole different vaccine, but you're just saying it's doubling the dose or some percentage
Essentially
increases.
like that.
Okay.
Yes.
Well, Kevin, do you question the seniors that come there on a regular basis as to whether or not they've had flu shots and
No, that's
shingle
kind of a
shots?
personal, private question that they need to talk to their doctors about. What we do is we work with Henry Mayo, and they come over and offer the flu vaccine every single year. We have terrific partnership with Henry Mayo, and they bring over 100 or whatever else they need and let us know, and we let everyone know that if they want to get it, it's an easy, accessible one day. They can always get it from their doctor or many, many places, of course. We just make it accessible to Senior Center a couple times a year, strictly with Henry Mayo.
Yeah, that's important. I think a choice is important, making sure that they're informed about it. Sometimes people, given this era, I've had some, at least in my sort of scenario, where patients are a bit more cautious about vaccines in general. I think it was just the history of essentially what happened 2-3 years ago, and people are just more cautious about it, which is understandable. But it's important to work with the patient, work with them, educate them if they need more information, and whatever choice they make, honestly, just respect it and kind of work with them.
Yeah, because the Senior Center for